Hello, my name is Seamus and I will begin our presentation today. Our group is composed of Vish, Denny, Jack, Ashley and myself. We will be presenting today on supporting and growing Aboriginal knowing, being and doing. How do we bring these unique Aboriginal perspectives into our future medical practice? We begin by acknowledging the traditional owners and custodians of this land, the Whadjuk people of the Noongar Nation, and pay our respects to elders both past and present, for they hold the knowledge, the language, the traditions and culture of their people and their land. In beginning today, I hope that the marker will find grace for any errors that are made and know that they are both unintentional and occur in our pursuit for higher standards of care. As a group, we've decided to approach the presentation by interweaving related themes, elements and evidence we uncovered in our research. Our presentation will therefore be built upon the following central thesis. Aboriginal and Torres Strait Islander people nurture and maintain strong ties to country, family, culture and social and emotional well-being. As healers and protectors, the role of current and future medical practitioners is to support and grow these unique perspectives of knowing, being and doing. This partnership can be achieved through the evolution and cyclical learning of cultural competency, culturally safe practice, advocacy, and culturally relevant care that is holistic. I begin today with a quote from Martin and Mirabupa's seminal 2003 paper on Indigenous research. The protocol for introducing oneself to other Indigenous people is to provide information about one's cultural location so that connection can be made on political, cultural and social grounds and relations established. Adhering to protocols developed for and by Aboriginal people provides a pathway to beginning to engage in culturally safe and competent care. So, my name is Seamus and I'm a Wadjala man. I grew up in Mullawa on Wadjuri Yamatji country. Mullawa means place of fog because the town sits in a depression in the land and that's where the fog banks roll down in the winter. In autumn, after the first rain of the season, you can get bimba, which is like a honey syrup from the acacia trees out there, especially around the coal seam. Cultural competency, by definition, is the interaction between organisations, institutions, individual practitioners, and Aboriginal people in a way that demonstrates awareness of the impacts of colonialism, the strength of connection between people and country, and a willingness to work in partnership in the spirit of mutual respect. Cultural competence is a strength-based approach that is dynamic. Coffin's cultural competence continuum, shown in the slide, can guide a practitioner's understanding of these concepts. Cultural competence manifests differently at different levels of organisations, and how an individual practitioner may be competent is not the same way in which an organisation may be competent. An individual's competence may differ based on context. For example, as a mental health nurse, I work closely with Aboriginal patients in a psychiatric hospital. When working with Yamatji consumers of mental health services, I'm able to demonstrate a better shared understanding of culture, country and ties to family, and the ways in which I can interact with the consumer are safe and conducive to a positive outcome, which ultimately is always to return to country and access services better suited to Yamatji ways of being. I've tried before to extrapolate my understanding of Yamatji being to individuals from other language groups, and I found that this has impeded my ability to form a therapeutic alliance with the consumer. In reference to Coffin's continuum, I would align with the area of cultural pre-competence, as I possessed the desire to deliver quality services, but at the time did not pay careful attention to the dynamics of difference. In line with Coffin's continuum of cultural competence, Sinclair has identified 3 ways of stratifying an individual's cultural competence by classifying them as beginning, emerging, or evolving with respect to ways of knowing, being, and doing. In the interest of time, I won't read through each specific element of the framework, but I'd like to draw attention to an important element that can be difficult to speak about. Note the use of empowering and resistive language to cultural competence as a tick box exercise under evolving and ways of doing. The concept of tension is important in interpreting cultural competence, as it acknowledges that an imbalance exists between Aboriginal people as patients and healthcare workers, stemming from and perpetuated by colonialism and our current institutions. This imbalance should be actively opposed. We should not shy away from this tension, and actually, it's a tool to be utilised despite being people being made uncomfortable due to either conscious or unconscious privilege, because it drives questioning, self-reflection, and collaboration.
To improve Aboriginal people's health service engagement and mitigate the disparities they face, it is imperative to bolster the cultural competency of health services through reciprocal collaboration and partnership. Both the literature and current national policy recognises the significance of effective collaboration between non-Aboriginal professionals and Aboriginal health workers, but also frequently highlights the challenges in achieving this goal. Successful collaboration between Aboriginal and non-Aboriginal healthcare providers hinges on enabling and empowering factors that can be implemented at the organisational, workforce and interpersonal levels. Cross-cultural collaboration demands traits like persistence, humility, flexibility, courage, leadership and humour from health professionals. Collaboration entails building solutions within communities from the ground up and developing respectful relationships that reflects a willingness to share power. Through the sharing of power, skills and experiences, new ways of knowing, being and doing can emerge. Aboriginal ways of knowing encompass social, political, historical and spatial learning processes, taught in certain ways and at certain times. They are purposeful only to the extent of its application. No one person can be completely knowledgeable, and each person holds a set of knowledge that fulfills and reflects certain roles. The process of understanding and connecting with one another involves acquiring knowledge about the local Aboriginal community, its history, language group and elders. Therefore, it is essential to foster positive working relationships with a diverse group of colleagues. Understanding how knowledge is gathered from the community and recognising who holds this knowledge is crucial in building trust. Aboriginal workers appreciate colleagues who take the time to listen, requiring patience and mindfulness from their non-Aboriginal counterparts. For example, the location and characteristics of Aboriginal knowing can be counter to non-Aboriginal knowledge and evidence, and this can become a source of tension. Effectively managing this tension is crucial, especially when implementing new health initiatives. This may involve gaining support of team leaders and managers, as well as adopting health screening schedules that are sensitive to community commitments and protocols. Aboriginal ways of being refer to processes and experiences that acknowledge the self as interconnected and constructed in relation to others. One way of getting to know someone involves introducing oneself within cultural, familial, and historical contexts. Non-Aboriginal staff must reflect on how their Western ways of being interacts with Aboriginal ways of being. Understanding Aboriginal health-seeking responses is facilitated through recognising ways of being. This is an important area of learning, particularly for non-Aboriginal staff, as they seek to identify reasons contributing to potential disengagement with health services. For Aboriginal people, prioritising individual health treatment and needs can be difficult, as their actions and decisions are often influenced by the needs of their community. Collaborative working relationships can provide opportunities to co-construct joint solutions. Occasionally, conflicts may arise between Aboriginal and non-Aboriginal workers due to their differing disciplinary, organisational and cultural perspectives. However, conflict management is a skill frequently utilised by many Aboriginal health workers, offering valuable knowledge and resilience from which their non-Aboriginal colleagues can benefit. Ways of doing are a critical aspect of how successful cross-cultural collaboration is demonstrated and can be defined as the ability to change healthcare practices and perspectives. Critical to these ways of doing is the ability to share power. When collaborative relationships strive to be equal, the Aboriginal community becomes more engaged. This requires demonstrating honesty as well as persistence and perseverance. Being visibly engaged sends a critical message to other staff and community. For Aboriginal communities, the priority lies in presence and relationship building, while for non-Aboriginal people, this may seem less productive and time-wasting within a framework that is focused on targets and outcomes. While some health professionals find it uncomfortable to articulate their perceptions of differences and similarities, leading to a tendency to avoid finding a resolution, it is important to view this as an opportunity to learn and strengthen working relationships. Rather than taking criticism personally, it should be valued as indicative of genuine relationships and another opportunity to demonstrate commitment to collaboration.
An individual's health status is complex and intricately tied to their circumstances, where variation in these can lead to health inequalities. For most people, this centres around income, education, employment, social support or inclusion, and the external natural environment you find yourself in. But for Aboriginal and Torres Strait Islander peoples, there is additional factors that contribute to their social determinants of health. For Aboriginal and Torres Strait Islander peoples, health is holistic, relational and interconnected. Health to these populations does not only refer to the physical well-being of someone, but also refers to social, emotional, spiritual and importantly cultural well-being of their community. This whole life view does not stop with those who are living, it's a cyclical concept of life, death, life. Cultural safety encompasses the competent care provided to individuals or families by healthcare professionals who have engaged in reflective processes regarding their own cultural background. They can acknowledge how their cultural identity influences their practice, and cultural safety is an ongoing process of self-reflection and acknowledgement of diversity between practitioners and their patients. So given the idea that culture shapes an individual's understanding of the world, you could then assume that a health professional's cultural perspective is formed their perception of their world. This results in their approach to whatever their healthcare relationships may be. While we hold diverse perspectives on health and well-being, mainstream healthcare systems often prioritise a Western-centric view, their traditions and their understandings, which will potentially overlook important Indigenous perspectives. An essential aspect affecting Aboriginal health outcomes is access to appropriate services where multiple dimensions of their health are embedded and considered. While the principle of treating patients equally irrespective of their race is often upheld in modern healthcare, this approach of being what's called culturally neutral or even colourblind can unintentionally perpetuate systemic racism. By adopting this stance, the dominant culture may overlook instances of racism and discrimination, which reinforces the ideology of them being non-discriminatory. This stance fails to acknowledge the importance of addressing racial experiences, cultural perspectives, and historical traumas, thereby maintaining the status quo. Embracing this approach will also dismiss the reality of any negative racial experiences and cultural diversity, while also failing to recognise the distinction between providing equal care and providing equitable care. This leads to something called ethnocentrism. Ethnocentrism is the view that our own way of thinking and acting are central and neutral, and from which all others are viewing as well. This underpins bias in the safety and quality of healthcare and can result in inadequate care and therefore poor health outcomes for Australian Indigenous peoples. Embracing culturally safe practices where the recipient of the care holds the authority to judge the appropriateness of this care is a key strategy in achieving the goal of equitable care. Factors such as cultural adaptability of the healthcare workforce in designing and delivering programs and services will present both obstacles and also present advantages to Aboriginal and Torres Strait Islander people access to healthcare. Throughout literature, it's shown that when healthcare is provided to Aboriginal and Torres Strait Islander communities by an Indigenous healthcare worker, it enhances access to suitable healthcare, which will then result in improved health outcomes for these patients. But despite this, roughly 1% of the current health force in Australia identify as Aboriginal or Torres Strait Islander. It is imperative to focus on efforts to increase Indigenous representation within the health sector, aiming for sustained growth for the future. Addressing the cultural safety of the entire workforce as a whole is also essential for better catering to the needs of Aboriginal and Torres Strait Islander communities. So you must be thinking what's been done to ensure cultural safety. And as of 2020, the Medical Board and Australia Health Practitioner Regulation Authority, or AHPRA as it's better put, have put forward regulations which are trying to ensure cultural safety and respectful practice. A medical practitioner must acknowledge colonisation and systemic racism. They must acknowledge and address individual racism and their own biases. They must recognise the importance of self-determined decision-making, partnership and collaboration in healthcare, which is driven by the individual, family and their community. And they must also foster a safe working environment through leadership and support the rights and dignity of Aboriginal and Torres Strait Islander people.
So the approach to Aboriginal healthcare should be holistic and interrelates in several aspects. The concept of holistic healthcare for Aboriginal people is not limited to just their physical well-being, but rather looks broader and includes the social, emotional and cultural well-being of the whole community, in which the individual is then able to achieve their full potential. What does this look like though? Well, the holistic approach not only encompasses the Aboriginal concepts of health, but rather spreads to include the interrelational factors listed. It must crucially be understood that when the harmony of these interrelations is disrupted, Aboriginal ill health will persist. The social factors can look like an individual's social support or interpersonal relationships. The psychological factors, these include things like cognition, belief, values and coping strategies. The overall functioning and well-being of an individual can be impacted by the biological factors, which can also be related to their effects of harmful substance use. Finally, the cultural and spiritual factors include a person's sense of their culture and their practices and beliefs that support their sense of spirituality, connection to country, ancestors and community. The holistic approach is supported and implemented by using the social and emotional well-being model. There are 9 guiding principles that take a really broad lens on Aboriginal health and encompass the knowing, being and doing aspects of Aboriginal healthcare. These look at a holistic, broad approach to care, self-determination, cultural understanding, kinship, cultural diversity, the impact of history and racism, recognition of human rights, and the recognition of being Aboriginal as a strength and not a weakness. Let's take a minute to think. How can we as future doctors and junior doctors clinically apply this holistic approach to Aboriginal health within the Western biomedical model? Firstly, we need to look beyond what is within the Western biomedical model and be culturally responsive, client-centred, and use this holistic model for providing care. We can do this by engaging with individuals to create shared goals and values, sharing culture, be open communicators, have equal value of all contributions that are made and actively listen to what is being said, and a willingness to learn, and also having the respect for differences in views.
In considering holistic health, it is also crucial to recognise the importance of advocacy in physicians' roles, particularly when caring for Aboriginal patients. Advocacy goes beyond treating immediate health concerns, and it involves understanding and addressing the broader social, cultural, and historical factors that impact health outcomes. When working with Aboriginal patients, this means actively supporting and integrating Aboriginal perspectives of knowing, being, and doing into our medical practice, advocating for policies that address health disparities stemming from the long-term effects of colonisation and oppression, as well as fostering a culturally safe healthcare environment. By embracing advocacy, we can truly embody the principles of holistic health in our medical practice. Factors such as language barriers, discrimination, and cultural appropriateness have prevented 32% of Aboriginal people from accessing health services when they needed to in 2019. To bridge this gap, health professionals must advocate for legislative and financial reforms to address the social determinants of health, allocate resources to areas in need, and adopt a culturally sensitive approach in their healthcare delivery by building trust, engaging with Aboriginal communities, and self-reflecting on biases. Aboriginal liaison officers and health workers are instrumental in creating culturally safe and responsive healthcare environments. They are primary healthcare professionals that can provide clinical, cultural, social, and linguistic services to Aboriginal people living in remote, regional, and urban communities that are often underserved by mainstream health services. They aim to break down the cultural barriers that exist and provide advocacy and emotional support, as well as offering advice to non-Aboriginal staff regarding cultural practices and protocols. They are role models for holistic healthcare in practice. Aboriginal health workers embed the community's cultural values, customs, and beliefs into service delivery by bringing with them the Aboriginal perspectives of knowing, being, and doing, and have been shown to improve the health outcomes related to several diseases like diabetes, asthma, mental health, and maternal and infant care. Further, they also improve Aboriginal patient treatment compliance, reduce the rates of discharge against medical advice, and help non-Aboriginal workers provide more culturally appropriate care. In addition to Aboriginal health workers, we also have Aboriginal community-controlled health services, which were established in response to the poor service that Aboriginal patients experienced, as they were often excluded and marginalised from mainstream health services. Aboriginal healthcare models are underpinned by cultural customs, values, and beliefs. It is important, therefore, to make mainstream services more culturally safe through things like cultural competency training, community engagement, and most importantly, through Aboriginal staff and input. As future doctors, we must be aware of these services available so we can collaborate with them or refer Aboriginal patients when needed. Partnerships between Aboriginal and non-Aboriginal workers improve the cultural appropriateness of the healthcare delivery and foster community participation, as well as breaking down barriers to the service delivery. And finally, supporting Aboriginal knowing, being, and doing, we can, as future medical practitioners, advocate for policies and programs that promote cultural competence and safety and adopt the holistic approach to improve Aboriginal health outcomes and reduce health inequities. We must also advocate for ongoing cultural competency training for all hospital and healthcare staff and utilise Aboriginal specific health services so that Aboriginal patients have access to culturally safe care. We must actively seek out and collaborate with Aboriginal health workers and liaison officers when treating Aboriginal patients. And we must finally advocate for a commitment to ongoing self-reflection and learning about Aboriginal cultures, histories, and perspectives. And in doing so, we will be participating in the reconciliation process that will improve our delivery of healthcare to Aboriginal and Torres Strait Islander patients. Thank you for taking the time to listen to our presentation today. We hope that other healthcare professionals will also take these perspectives into their medical practice and contribute to more culturally appropriate and safe care.